All right, well, welcome back. We're going to begin to work with what I call thoracic spine levers. Again, a bit of a shotgun technique, especially if you're not as strong in your assessment protocol. These are, in a way, techniques that can get you some really quick results. This is designed to work the middle of the back, the mid-thoracic region, which controls a lot of that spine tension. I'm going to be asking Susan to do a series of muscle energy technique moves, some of you are familiar with, in which she's low-loading the area because it's really geared more for articulation. So you really could call this, in some terms, a joint energy technique. I'm sure some of you might disagree with me with that, but it's really geared more towards the articulation and the connective tissue. And when you want to work those, you tend to do low-load force. It's a resistive. For those that have had a lot more study, this would be an isometric contraction, although there is debate that that even exists. So for some of you, it's isotonic. That said, what's going to happen is it's paired motion. And when you do paired motion, you then take the vertebrae and target both side bending and rotation. So the simplicity of this is really lovely. What you're going to do as a paired unit, you're going to make sure the body rolls forward and that the elbows are apart. Now on some folks, the elbows will sit like this. Don't worry. If you can don't force them into the position. We had actually looked at this before we did it on film, and she was actually higher up. So already the work I did on the lines front and back has dropped her arms down. Now you'll do this from both sides because this will attack one side of the thoracic spine. You're going to need to go ahead and assess and work the other. So here's how it goes. Neutral position, we're going to ask Susan to take both hands and just lightly press down in that direction. I'm going to just keep the elbows together lightly. She's going to take a deep breath, and on exhalation, that's what she's going to do. 10% perfect. Count of about 3, 4, 5, release. And then I move it a bit, and you'll see, look at that, look at the drop. So we've improved very quickly a restriction percentage, and now she's going to get a little bit of a nice sensation wash up, and really for the first time, that in a non-intrusive way using leverage has worked that thoracic spine without digging, which I think is really important and actually impressive. The next position, of course, if you can go up, you can go down. So again, pressing about 10% up. That's right. And then release. And sometimes you may want to put your arm here because you want the position higher. Go ahead and do that again. Keep your elbows together. Perfect. And release. And she'll feel the target. You can begin to see that. Look at that. It's still even dropping further. So then what we do is we take care of the flexion extension component, and you're going to resist the paired prayer hands going up. So we're going to have you bring it. Yes, perfect. That'll be cranially, they say. And release. And then I give it a little motion. And then we take the paired arms going down. Okay? Great. That's the flexion component and release. So extension actually is going up, flexion's going down because you remember you're dealing with the spine. And you can again see on that component even a greater drop in the arms. So we've had a lovely model in terms of restriction because what's happening is change is happening as we can see it, and this is the kind of change you're going to get. The final is to go ahead and work the scapular adduction movement, which is scapular abduction. And all you have to do is just place your hand between two elbows, and you're going to ask the person lightly, again at the same rate of pressure, to pull apart and release. And on occasion, if you want it to come together, you just put a light fist there, or you can drop your hand to make it softer, and they can pull together and release. And what happens very quickly is you tend to open up the rotation and side bend elements. All you have to do is turn them, roll them over to the other side, repeat the protocol, and basically you've gone and done a very quick thoracic spine lever technique and protocol.